Hello, everyone. I'm Ian Smith with FedSmith.com. I'm here today to share with you some information about the 2026 Federal Employees Health Benefits Program premiums. In particular, what's driving the increases in the amount of premiums, as well as the impact of these increases on one of the more popular plans within the FEHB, and that's the nationwide Blue Cross Blue Shield or BCBS plans. So let's get into it. As I'm sure you're well aware, it's no secret that the cost of healthcare in this country is increasing rapidly. And in the FEHB, we've seen that over the last several years, and in the last couple of years in particular, the FEHB has experienced double-digit premium increases for 2 years in a row now. For the enrollee share of premiums, they have experienced a 12.6% average increase for 2026, and that's after a 13.5% average increase last year in 2025. Now, again, that's just for the enrollee share of premiums. The total average increase in 2026 will be 10.2%, and that factors in the government share of the premiums as well, what the government pays towards your health insurance. What's driving these increases? Well, this is a list of some of the likely contributing factors. One of them is medical cost inflation. Hospitals, clinics, and doctors continue raising prices to offset higher labor and supply costs. Healthcare inflation is expected to run roughly twice the rate of overall inflation in 2026. Prescription drug costs are another factor. The increased use of expensive specialty drugs, especially new treatments for cancer, autoimmune disorders, weight loss, to name a few, add billions to total program costs. Drug spending is the fastest growing part of FEHB outlays. A greater use of health services also, more frequent medical visits, new diagnostic technologies, and expanded coverage for behavioral health and virtual care services have all increased utilization per enrollee. And related to that too, we have an aging population in this country, and that's true within FEHB as well. With a growing share of retirees and older workers, the FEHB population uses more healthcare overall, and that drives up average claims costs. Plan mix and contribution formulas. The government share of FEHB premiums is capped at 72% of the weighted average premium. So when more participants shift into higher price plans, the government contribution increases more slowly than total costs, and that leaves enrollees to cover more of the rising costs. I wanted to look at the impact of the increasing premiums on the BCBS nationwide plans, as I said. There are three plan types offered within this: the FEP Blue Focus, the FEP Blue Basic, and FEP Blue Standard. And the FEP Blue website, which is fepblue.org, has more information about these plans. According to the website, the Blue Basic plan has been the most popular choice within the FEHB for over 15 years now. I put together some tables that illustrate the premium increases from 2025 to 2026 for these BCBS plans. The figures that I'm including here are for the enrollee share of premiums only. And you can see that among the self-plan type, the FEP Blue Basic plan has the largest increase. In looking at the self and family plan type, again, the Blue Basic plan has the largest increase, while Blue Standard has the lowest. And I should mention quickly also, if you find that you want to study any of these slides in more detail, then please pause this video during playback if you need more time to read them longer. And the Self Plus One plan type, the same is true as well. It had, as in the others, the basic, the FEP Basic, had the highest increase of the three plans, as you can see here. Now, this last table is a little bit different. It provides a breakdown of the average increases for each enrollment type and plan option from 2025 to 2026. Not surprisingly, Blue Basic had the highest average increase again across the 3 plan types. But the average increases among the 3 plan type options was pretty evenly distributed, as you can see. Despite the significant annual increases in premiums, the FEHB program remains a very valuable benefit for current and former federal employees. And these are a few reasons as to why. The government contribution I mentioned briefly earlier, the federal government continues to pay on average about 70 to 75% of the total premiums, which protects enrollees from even higher costs. If you go to the OPM website and you download the premiums for any given year, they have spreadsheets that detail the costs of each of the plans in the FEHB, and it's broken out by the enrollee share, the government share, biweekly amount, etc. And you can see the government's picking up a significant portion of those costs. I mean, imagine if you had to pay the enrollee share plus what the government's paying. That would be much more expensive. So that is a very valuable contribution that the government's making. Also, the extensive number of plans. Enrollees can choose from dozens of nationwide and regional options during each open season, which helps to keep the prices competitive over time. There's also guaranteed coverage and portability. FEHB offers lifelong eligibility into retirement with no medical underwriting, a benefit that's rarely found in the private sector. And the comprehensive benefits, all FEHB plans include preventative care, mental health services, and prescription drug coverage, which meet or exceed the ACA standards. That's the Affordable Care Act. And these are some general tips that can be helpful when choosing FEHB plans. It's important to review your current plan and any other available plan options available to you each year to see what's going to best meet your needs. You can eliminate unsuitable health insurance plans by checking availability and deciding on plan type, for example, HMO versus PPO. Also, you might consider a high deductible plan in conjunction with a health savings account, that's an HSA, for younger, healthier individuals, whereas a PPO or an HMO might be better for those with regular medical needs. You also want to make sure that your desired plan covers your doctors and prescriptions. If not, those would probably be ones you'd want to end up eliminating. And also be sure to plan for known costs in the coming year. For example, if a pregnancy or a surgery that you know you're going to have, you'll want to ensure the plan you choose will meet your medical needs for the coming year. And planning in advance for any known costs is one way to do that. And also remember to use available resources. One that you may want to check out, the checkbook guide to FEHB plans is a useful resource. And that website is checkbook.org. It provides reviews of FEHB plans. It is a subscription-based service. However, some agencies provide subscriptions for their employees. And the checkbook website has a listing of agencies that offer access, or your agency should be able to tell you also if it has a subscription available that you can use. The OPM website is another good resource. It has listings of all the FEHB plans, info and premiums, and comparison tools. And as one other thing to check is the insurer's website. I mentioned the plans that I discussed here today, the BCBS plans, the Blue Cross Blue Shield. That website was fepblue.org, and it's got a lot of information about each of those plans on it. I've also included links in the description below to some related articles on fedsmith.com that you may find helpful. And lastly, just an important reminder, the FEHB open season runs from November 10th to December 8th, 2025. That's coming up very quickly. I'm recording this on November 3rd. So federal employees and retirees will have the opportunity to choose their federal benefits for the 2026 plan year during the open season for health, dental, vision, and flexible spending account benefits during this time. You can visit the OPM website for more information. So thank you very much for watching today. I hope you found this information helpful. And again, I've included some links in the description to articles with some additional details. Thank you and have a good day.